Before the days of electronic beds, our patients had to be rolled from side to side and placed on lift devices to obtain daily weights. Not only was it very time-consuming for the staff, but it was uncomfortable for the patient. With our current Hill-Rom beds, we have the luxury of being able to weigh our patients in the bed without moving them. Following a few simple rules will ensure accurate weights for all our patients. Daily weights for some of our patients are very critical to their care. Just like blood pressures and heart rates, they need to be accurate. You might ask yourself, what does a doctor need with the weight of a patient? To answer that, there are a lot of medications we administer every day that are weight-based. For example, vancomycin is a weight-based antibiotic. When given in the wrong doses, can cause kidney failure. Heparin, a blood thinner, can be based on weight. And if the doctor has an incorrect weight, the wrong amount of medication can be given, leading to adverse side effects, even death. We as nursing staff, RNs, LPNs, and CTs are all entrusted by the doctors and pharmacists to provide them with accurate data to care for all of our patients. In order to maintain that trust, we must have a standard way of obtaining a patient's weight. I will go over the standard rules for obtaining a weight using the Hill-Rom beds on our unit. When we are told of a new admission, we should first make sure the bed has standard linens. This would include a bottom sheet, a lift sheet, a top sheet, a standard blanket, 2 pillows with pillowcases, a patient gown, and the call light. After you have made sure the correct items are on the bed, you need to make sure that the mattress is not touching the head of the bed. The headboard is not part of the weighing system for the Hill-Rom beds, and anything that is touching it will cause the weight to be inaccurate, sometimes as much as 12 to 18 pounds. One of the things that can cause your weight to be wrong is the mattress is not in the correct positions. These beds have an extender at the bottom which keeps the mattress from touching the head of the bed. If you look underneath at the end of the bed, there's a bar. You lift the bar, pull the bed out. That extends the bed out so the mattress can be pulled down so it's not touching the head of the bed. So after assuring there are only standard items on the bed, push the weight button. When the hand starts flashing, stand back and do not touch the bed as it calculates the weight. When it comes up with a weight on the bed, press the 0 button. Continue to hold it until the hand starts flashing and then step back and let the bed reweigh. This will zero the bed, making it ready for your new patient. The patient should be dressed in a gown and laying on the bed in order to use the bed scale. Remember, the mattress should not be touching the head of the bed. Press the weigh button and stand back away from the bed. The bed will flash, letting you know it's calculating the weight. Then it will display the patient's weight. Be sure to record the weight in Epic. Over the course of a patient's stay, items may be added to the bed, such as SCDs and extra pillows and blankets. According to standard work, you should remove the SCD pump from the end of the bed and ensure that there are only standard linens on the bed before doing a daily weight on the patient. Never reweigh the bed and zero it with a pump on the end of the bed, because the next person to come along may not know that you did this and will give an inaccurate weight. This will cause rework for your coworkers and an inaccurate weight for the patient. Another consideration to remember is that the Foley bag will weigh with the bed. Be sure to empty the Foley catheter before you weigh the patient to ensure accuracy. There are only a few times that you would want to re-zero a bed after the initial weight is obtained. One would be when we add a specialty mattress and pump, if there is a very large discrepancy in the weight from the day before. When obtaining daily weights, be sure to look at the weight from the day before and make sure that there is not a significant change. Plus or minus 3 pounds can be a significant change that should be reported to the RN or LPN as soon as possible so they can assess the patient and notify the doctor of any change. Pride and accuracy in our work should be a standard for anyone performing patient care. Doctors and pharmacists depend on us to report accurate vital signs on our patients. This includes their weights. So if we work together and follow standard work, we can ensure that our patients are given excellent care.